the most classical form of diabetes, and if you're looking for the symptom, the only symptom of diabetes in most cases is there is no symptom. It's a silent killer. Okay, it is something which messes up with your body hormones, your metabolism, and your other stuff. So in most cases, you would not find any symptom because it's a disorder. It's very important to understand, people, that if you are having disorders like PCOS or hypertension or diabetes, they are not kind of diseases what you need to tackle. They are more form of disorders, So disorders are usually silent. They mess up with your body, without you being noticing. However, just to make sure that there are people who display classical symptoms of diabetes, first is blurred vision. Your sugar, uncontrolled sugar levels would definitely have a very negative impact on your retina. So your sugar, high levels of sugar, uncontrolled sugar would often lead to blurred vision. You might also have episodes of dizziness if your sugar levels are just fluctuating, without a balance, without something, which is stable enough for your body to sustain. Frequent urination in nutrition, as we call it as, polyuria. So, the urge of you urinating would definitely increase. So that could be one of the reasons, So usually when you are getting yourself examined for diabetes, any healthcare provider would definitely ask for the prominent symptoms you are having. With diabetes, it is also noticed that, every person has either no symptoms or some other symptoms, to make sure that, the diabetes is getting detected. But frequent urination is one of the factor, and the prognosis where, it can take towards diabetes. Increased thirst, which is definitely seen in people, they basically, there is a constant urge of drinking something, even if you drink, you are not able to quench your thirst. So definitely that is also a part of diabetes classical symptoms. Constant hunger, even if you eat your meals, you are not satiated, you are not satisfied after having a wholesome meal. So constant hunger is also, it can pinpoint towards the progression of something is wrong with your insulin resistance. It is also taken into consideration because when you are planning a meal, if your insulin is not up to the mark, definitely you would have complaints of constant hunger even after having a full meal. So obviously you need to be very particular while pinpointing these symptoms, if it is asked by your educator or your healthcare providers. And numbness of limbs. There are people, in fact, many of my patients personally have this particular thing, where they face numbness of limbs, because the capillaries, the small cells which are responsible to distribute blood all over your body, they do get hampered because of the fluctuations in sugar levels. So numbness of limbs can also be considered as one of these symptoms. Apart from this, it's very important to understand that you might also have a feeling of lethargicness, dizziness, people don't feel like working. So, definitely these all can be considered as a part of diabetic symptoms.